Hundreds of millions of people around the world are dying from preventable illnesses. You know, there are lots of immediate health threats like gun crime, COVID, sort of infectious diseases that are immediate, that I think people are very aware of and very scared about, and they're sort of covered widely in the press. Whereas these more slow-burning chronic diseases, are just not well covered.
Between 1/3 and 1/2 of all deaths across the entire world are from diseases linked to commerce and industry. Some of the same threats are also doing massive damage to ecosystems, the climate, and the planet as a whole. Our investigative team goes deep to expose health crises and to inspire action.
We really want to paint a broader picture from a business perspective, from a local perspective, from a health perspective, from a data perspective, and across time. How do we do that as a small team? We do that in partnership with journalists all over the world.
One of the things that makes us unique at the examination, or at least there aren't many people operating in this space, is we want to fill in the gap where we can do work that governments aren't doing that they should be doing. But it really takes, it doesn't often happen that way where it's just one story that leads to something so immediate. Often it takes us staying on it and writing about it again and again. And I think newsrooms across the world are really are spread thin, their budgets are tight, and they don't often have the resources to stay on stories like that.
I joined the examination because I was excited to be part of a new kind of investigative journalism. Global investigative reporting that digs into and investigates the world's most powerful people and companies and how their decisions affect whether or not we're sick and whether we live or die.
I think covering stories about health and global health threats and really how that affects people in different parts of the world is really interesting. So there's the aspect of covering issues that are causing people the most harm, but also doing it on an equitable scale and trying to look at places outside of the US, outside of North America.
I cover tobacco, and the tobacco industry is probably the industry that has killed the most people in human history. 100 million people died in the 20th century from smoking-related diseases.
I cover the food industry, in which we look at ways in which the food industry affects public health. Diet-related disease is the leading cause of death worldwide, according to a number of studies. So what I do is report stories that examine how practices and decisions by big food companies and food regulators contribute to the safety or risk.
The data team provides and supports all the investigations that we do. We like to think of the data with a very international perspective. We want to deeply explain global public issues and what the numbers provide in this understanding.
I joined the examination because I wanted to spend a bit more time working on stories that impacted particular groups, and then I wanted to spend time with those groups in their communities and working with their local news organizations to bring about change.
We're actively listening to communities as we're developing story ideas. We're involving communities as we're reporting and making sure that our journalism is produced in the most accessible way.
We want to really connect with the communities on the ground who are most affected by these dire issues of health inequality and industry-driven death and sickness.
When I heard about the examination and how it was committed to not just Western media, but going beyond and making sure that partner news outlets were included and were brought up at the same level, not just at the distribution level, but co-reporting, making sure that the audience, whether it's in China, whether it's in Africa, was just as valued as the audience in LA or New York.
We are the examination, fearless journalism for a healthier world.
Investigating health threats and empowering communities, covering tobacco, big food, pollution, and more.
Subscribe to our newsletter. We will knock on your inbox once a week.